Yeah.
Good afternoon, my name is Cyrus Hill, and I'm going to be giving a speech about assisted suicide. So, did you know that assisted suicide is actually legal in the state of Oregon? Assisted suicide is the process of a physician providing the supplies to end one's life to a terminally ill patient in a humane manner. So, why I should be telling you this. I have read many articles about this procedure, this form of suicide, I guess you could call it. So I feel properly informed to tell everyone else about it. So, my thesis. I support assisted suicide, and I think it's a very humane way to end the suffering of a terminally ill patient. My 3 points. Assisted suicide eliminates suffering. It gives terminally ill people a right to control their own fate, and it can save the patient and family from super high expenses later on in life. So, main point number 1, it can help ease suffering. So people who are terminally ill can get worse, their condition can deteriorate, which causes them more chronic pain, which is my next subpoint. Many people with severe illnesses suffer from chronic pain that's never ending. According to a study that I found, more than 72% of people agreed that terminally ill patients should be given the choice for a doctor-assisted suicide. Another point I have is that sometimes pain can be linked to depression, which can impact a lot of people and make them very unstable, because their pain can be never ending for them. So it dives down into depression. Okay, transition. Ending the suffering should be a personal choice. So main point number 2, assisted suicide honors the right of the individual and gives them the best choice that they see fit. So assisted suicide gives the individual a choice of doing what they feel is right for them. It lets them make the decision what to do with their most precious possession, being their life. People have a right to decide what they want to do with their life, as it is their property. So in another article I read, the 2020 edition of Opposing Viewpoints, called Assisted Suicide. The author is Gale Opposing Viewpoints, an organization that creates articles about different viewpoints. They stated, and I quote, "An individual's rights and personal freedom are honored when they are allowed to decide when to end their life regardless of their health status." So yeah, I feel like people should definitely get their own choice, and that's a benefit. I shouldn't say benefit because it's not good. It's something that comes along with assisted suicide. So speaking of rights, what you do with your money is your choice. Assisted suicide can end unneeded expenses that occur for your family later on in life. Medical procedures can be super expensive, as many people know. Even a simple trip to the doctor's office can be extremely expensive, but when you add that on top of a terminally ill patient whose condition is deteriorating, it can just be bankrupting for some people. So if the ill person is terminally ill and they have no chance of survival, they could opt to not burden their family and go with assisted suicide. Another article by Gale Opposing Viewpoints, it indicates that by giving them the choice, they can end their life on their terms without incurring high expenses to their family. People have a choice of giving away their possessions in their will, such as money or any other things of monetary value. I feel like they should be able to have that option to do what they choose with their most prized possession, being their life. And it's not a simple task for assisted suicide. It requires 2 doctors on separate occasions to check the patient, make sure they are sound of mind. It requires 2 witnesses while the doctors are doing their checks, neither of whom can benefit from the person's life ending, so they can't be like family that are going to be included in the will. They can't be any close friends, relatives that are going to benefit from that person's death. So, assisted suicide should be legal as an opportunity to help people ease their suffering. Assisted suicide eases people's suffering, it honors the rights of individuals, and ends their suffering without incurring high expenses to their loved ones around them. Imagine being sick and in constant pain, waiting to die, while your family pays an arm and a leg to keep you alive for a few more hours, being sad, depressed, and in pain. Would you rather choose that, or choose being surrounded with loved ones, not having them pay so much, and being surrounded by loved ones, not having them pay so much, and being able to go on a happy, peaceful note on your terms? Thank you.